afternoon, going evening. We're going to start with prayer, and then we're going to proceed as we, in great excitement, look forward to this very special program. Let us all bow our heads for prayer. Dear God, we thank you for this lovely day, Sabbath day of rest and gladness. We are thrilled at the prospect of knowing that we are your children and that you watch over us day and night. We are grateful for the multiplicity of blessings that you've so copiously showered upon us, and we just want at every moment to just give you thanks so that you can see how much we appreciate you. As we move into perspectives this evening, we pray that you will guide in everything that we do and that we will be careful to give you all the praise and all the honor because you are truly worthy. Thank you for hearing our prayer. Be with the presenter this evening, that she will say the words that you'd have her speak and that we will be benefited by her presentation. Thank you for hearing our prayer. In the name of the Father, in the name of the Son, and in the name of the Holy Spirit, let the people say, amen and amen. I'm very happy to be on this forum this evening. We are on the program called Perspectives. It's a program that we have every Sabbath evening at 5 o'clock. It's a program where we are able to opine on various subjects. It's a program where we're able to share various educational information. It's a program where we are able to inspire those who are great listeners to do better and to excel both academically and otherwise, more so spiritually. We're grateful for this opportunity this evening to have a very special program on this, or Breast Cancer Month. The emphasis today has been about breast cancer awareness. And I'm sure that some of you are aware that not only women are not the only ones that have breast cancer or that succumb to it or that are exposed to it, but also men. So we ought to be here. And if you notice, I wore my pink today. So I'm with the program, and we look forward to hearing much about that. So at this time, I'm going to have the introduction of our special guest, and I want to thank Brother Bobby Martin, we call him affectionately Bobby Martin, for having given me information about this very special speaker. I am really thrilled, and I'm boasting all over the place about this special gift that we have of this lovely individual. But he knows her very well, so because of that, I'm going to ask him to come up right now and introduce our very, very special presenter this evening. So over to you, Bobby. You do the presentation.
Thank you, Pastor Wright. Thank you, Pastor Wright. And I'd like to welcome all of us who are here. I'd also like to welcome all of those who are in cyberspace and on the various platforms to this special program. I would like to introduce to you our special guest this evening, Dr. MONISHA BAHNOTE. She is very unique in terms of medical practice. One of the few physicians in the United States who has specialization in 5 different areas. So she has 5 certified in 5 specialties. So we're getting 5 for the price of 1, you may say. She is also a best-selling author. Her book is The Anatomy of Well-Being. In her book, she offers ideas as to how the body can leverage, our respective bodies can leverage its uniqueness to further our overall well-being. She also offers perspectives on the connection and the integration of both mind and body, how the mind and the body are very much integrated. On the clinical side, she has diagnosed over 1 million breast cancer patients, and she continues her work in that regard. And she thinks that our overall health in terms of mind and body and diet will definitely have implications for our well-being. So ladies and gentlemen, without further delay, I'd like us to welcome Dr. MONISHA BAHNOTE. I'd just like to tell her many thanks for her willingness and taking time out of her busy schedule to be with us this evening at Redemption Praise Temple. And I'd like to welcome her to our guests, both in person and in the various cyberspace platforms, as we attentively listen to what she has to present to us this evening. Thank you.
Thank you so much. Can you hear me over there? Just want to make sure you can hear me. Wonderful. Thank you.
Yes.
Thank you for the introduction. I can't see you. I see myself on a big screen. Hope I look okay. But if any of you who are in our Zoom room want to come off camera to keep me company, I would love that. I would appreciate that. So I'm just not looking at myself. But the way I always like to start all of my talks is really taking a moment to come into our presence and into our being and get our body into a more parasympathetic, relaxed state so we can receive the knowledge, so we can receive everything we need from this time together. So if you guys would take a mindful minute with me where you just take a deep, full breath in with a long, slow exhale, allowing your eyes to gently close or having a softer gaze. And then another nice big breath, inhale, and a long, long, slow exhale so that you can begin to feel the body release. One more deep, long inhale, and on the exhale, allow yourself to fully arrive in this body, into this moment and into this breath. Now letting go of control of the breath and simply allowing yourself to be here. Letting be all the effort it has taken to bring you here now. Letting be all the thoughts, pressures of what yet has to come, and giving yourself the gift of this moment. This time together with your colleagues. As you're ready to take a moment to turn inward and notice, asking yourself, how am I now? How am I holding my day so far in my body? Leaving yourself 1 to 2 words, what it is here for you now, whether it be tension, excitement, anxiety, readiness, whatever it may be, simply notice it with an attitude of curiosity and kindness. Now take a fuller, deeper breath and refocus back together. Thank you so much for joining me in today's talk. I'm going to share my screen. Oops, if the Redemption Praise Temple would allow me to share my screen so I can share my slides, that would be wonderful. All right, perfect. And I'm open to communication in the chat if you are more comfortable with that. Feel free to put questions in as I'm giving the presentation. There is quite a bit of information in this presentation, and I'm going to try and give you as much of it as I can. If you do have a time constraint, please let me know. So just a disclaimer that this presentation is for informational, educational purposes only. It is not a substitute for professional medical advice. I am a doctor, but I am not your doctor yet. But so this does not create a physician-patient relationship. With that being said, meet your speaker. So you've already had my introduction, so I'm not going to go quite bit into that per se, but I do have a breast cancer fellowship. So actually I've diagnosed over 1 million cancers all over the body and 100,000 breast cancers. If I diagnosed 1 million breast cancers, I'd probably be 100 years old. But there is definitely way too many breast cancers. So, and that's what we're here to talk about tonight. I am happy to share with you information on my book. I know that one person who is present today will be winning a copy of my book, and I will allow the church or whoever is most in need for this to be receiving this gift from me. My goal really is to combine the ancient wisdom that we have with mind-body science to really help your body heal. And I do this through my medical clinic, online workshops and training, and in-person retreats. Now, you guys are all here to learn more about breast cancer, so let's get started with that talk. Why do we all need to know about breast cancer? Not just women, not just people who have a diagnosis. Really, we all need to know about breast cancer. For one, in 2022, over 287,000 cases of invasive breast cancer will be diagnosed in the US alone. Okay, so that's more than 250,000 will be diagnosed. Then we'll have more than 50,000 new cases of in situ cancer being diagnosed. If you ask me, that's a lot of cases. And then we will have almost 43,000 women die from breast cancer in 2022. So we have to do everything we can to not only support the women who have a diagnosis, but do the best that we can to prevent the diagnosis from reaching our friends and family members. Now, men do not get spared from this. Approximately 2,700 men will be diagnosed in the year 2022, and more than 530 men will die from breast cancer. So this also influences men as well. And as for the #1 diagnosis for women of all cancer types, breast cancer is the highest with 30% of new women cancer diagnoses. The only one that surpasses that is skin cancer, like squamous cell and basal cell skin cancers. But when we're talking about organs, breast cancer will be above lung and above colon for women. And the scary part is, on average, every 2 minutes, a woman is diagnosed with breast cancer in the US. This is how I have been diagnosing breast cancer. As a breast cancer fellowship trained physician, people go, how is it possible that you have diagnosed that much? I'm like, if every 2 minutes a diagnosis is happening, and I am just one of many doctors diagnosing this on a daily basis, that is a lot of cancer. So what are some of the risk factors for cancer? The major factors are increasing age. So as we age, the risk of us getting breast cancer increases. There are genetic mutations, but I want you to realize that the BRCA mutations that most people are familiar with, the breast cancers are really less than 5% of these breast mutations for the BRCA. That means 95% of breast cancers being diagnosed are linked to other things. All right, so keep that in mind. Having a personal history of breast cancer increases your risk to have another breast cancer. Anybody who knows somebody with a breast cancer may or may not have seen that some 10 years later, breast cancers can come back. Having breast cancer in a first-degree relative, radiation to your chest or breast area before age 30, and DES administration in utero. DES is no longer given, but when it was, that was one of the reasons. Now, we also have minor risk factors, which in this case, actually, even though they're labeled as minor risk factors, they are the most modifiable risk factors, and they actually have such a great impact. And that's what I'm going to show you today. So one of them being a lifelong sedentary life. So you're going to hear me talking about moving your body, why it's important to move your body, being overweight, especially if you're overweight in adulthood. Anybody who has had the luxury of experiencing menopause knows.
Recording stopped.
Oops. All right. Knows that as we hit menopause, we start increasing our weight. So really being conscious of being overweight, our reproductive history, and our alcohol intake. So when we think of cancer, there is an integrative approach to cancer, and I am a integrative medicine physician trained at the Andrew Weil Center for Integrative Medicine. And we like to take a focus on things that we can modify, right? So lifestyle, environment, genetics, we can't do too much about. We're born with it, but there is some genetics that we have the ability to turn on and off. And that applies for many, many diseases, not just cancer. So what do we want to do? We want to minimize exposure to known risk factors such as smoking, radiation, environmental toxins, obesity, and we want to increase exposure to beneficial factors such as physical activity, fruit and vegetable intake. And I'm going to tell you exactly which fruits and vegetables we want to be eating if we're not eating right now. So one thing you need to know about breast cancer is that there is at least 30 different types of breast cancer. So when you have conversations with your friends that they had a diagnosis and they might have gotten this treatment and somebody else got a different treatment, it makes it really difficult as an individual to compare that. Why is this person getting chemo and radiation? Why is this person only getting surgery? Why is this person getting hormone treatment? There's a lot that goes into the cancer diagnosis, and I want you to understand that. So when you do speak to another person that has breast cancer, their journey might look different, okay? And it doesn't mean that their journey's wrong or yours is wrong. And this is where I want you to be your own best advocate and talk to your doctor about why is it that I need this treatment? The more questions you ask, and if you don't get an answer that you're satisfied with, keep asking the questions. Because it is very important as an individual that has any disease, especially cancer, that you understand your disease process so you can heal from that disease to your best ability. And part of that comes from understanding it. The four main types that you're seeing here are, and you might know them as ER/PR positive, HER2 negative, or ER positive, HER2 negative, ER/PR negative, HER2 positive, and then the triple negative breast cancer, which is one of the hardest ones to treat because there's no targeted drug therapy for it. And this triple negative breast cancer is the breast cancer I see most often in younger females and younger females of African American descent. The youngest person I diagnosed with this was 18 years old. She was in upstate New York, and all she wanted to do was just continue with her college classes. This really kind of hit her, like, how is this going to impact her life and change her life? And I will tell you, her genetics were negative. And that's what concerns me when it comes to cancer, is that people think that, oh, it's my genes, and it's a lot more than that. It's really our lifestyle, and it's our lifestyle that we as individuals live and we pass on to our children, and then they pass on to their children. So just remember that what you are doing today is going to impact your family for the future. So what are the things that we can address? So one of them being alcohol. So when it comes to breast cancer, the reason alcohol influences it negatively is because alcohol causes the increase of estrogen in our body. And as you know, estrogen is linked to breast cancers. In addition, it also causes an increase of folic acid in the system. When that imbalance is created, it increases our risk. Ultimately, if you think about alcohol, at the end of the day, it damages our DNA. When our DNA is damaged, our cells are damaged and therefore cannot reproduce the way they need to do in a healthy way. And they become damaged and abnormal cells start growing. And that's essentially what cancer is. It's the uncontrolled growth of abnormal cells. So cells that were used to be normal now become abnormal due to multiple factors and grow abnormally. Alcohol has been shown to be the most consistent dietary component linked with breast cancer. And these empty calories lead to weight gain and excess fat, which we know is obesity is a risk factor for breast cancer. Alcohol is also associated with a more aggressive, fast-growing tumor. So remember I said there was 30 different types of breast cancer. So the ones that are higher grade, grade 3, the ones that grow faster are linked more with alcohol. So you're probably going, all right, well, how much alcohol is okay? Is there any amount that's okay? So I kind of want to give you some numbers here. So a 12 ounce of beer or 5 ounces of wine will increase your risk by 7%. Okay, so 7%, maybe not worried yet. That second can of beer, that second glass of wine will increase it by another 7%. So we're at 14%. So do keep that in mind that alcohol is doing a lot of things. It's impacting your liver. Your liver is part of the process of your estrogen metabolism, and it's damaging your cells. Now, next, how about exercise and body weight? How does that affect breast cancer? Well, so you remember the triple negative breast cancers that I told you that I see a lot in younger African-American females? Guess what? Physical activity is absolutely necessary for these breast cancers, and intense physical activity. That can really help these people because they don't have the options of drug treatments that other breast cancers have. Also, moderate exercise for hormone receptor positive breast cancer can reduce the risk. So what is the recommendation for how much exercise we should be getting on a daily basis? Recommendation is about 150 minutes of exercise per week, which is really not that much if you think about it. I think, what is it, like 22 minutes a day? And what I mean by moderate could look like going in the garden and doing some planting and moving or going for a brisk walk. You don't need to do the jogging, the running, the bicycling if that is not something you enjoy. But at the end of the day, we do want to move our body, especially because adult weight gain is associated with postmenopausal breast cancer. So now how about meal timing? Does meal timing impact breast cancer at all? If you are a late night snacker, definitely listen up. A study of 41,000 women found that consuming food after 9:30 at night increased their risk by 1.5%. So that might be something that, you know, without having to change what you're eating necessarily, you can go, all right, I'm not ready to give up some of my foods, but maybe I can stop eating at 8 o'clock at night. Maybe I'm done with all my food. And when it came to what dietary pattern was important, it was the overall dietary pattern is more important than the individual foods, although I am going to tell you some individual foods. And then what do we really want to do? We want to consume a wide variety of whole plant-based foods, essentially a rainbow, meaning a mix of phytochemical molecules. So why do we want this rainbow of foods? The different colors of foods have phytonutrients. Phytonutrients, there's different ones. Carotenoids are found in orange foods. Purple foods have their own. Tomatoes have lycopene. So you have all these different antioxidant phytochemical molecules. They are important because that is what is fighting disease. That is fighting all disease, not just cancer. So anything going on in your body, it will fight it. So if you're not eating your fruits and veggies right now, this is one more reason to start including them. So now, what are the foods you might want to stay away from? So some of these might surprise you. Dairy. So you might be thinking, all right, well, I was told that growing up that I needed dairy for strong bones. So if you're like me and grew up in the 80s, you remember those Olympic athlete commercials where they were telling us to drink dairy for our bones. Well, I will tell you that the research tells us now that dairy does not improve osteoporosis or bone health. It actually increases the risk of fractures. But what does it say about breast cancer? Well, so we found that dairy products increase the risk of breast cancer. They looked at about 2,000 women, and those women who consumed foods like American cheddar and cream cheeses had a 53% increased risk for breast cancer. And even those who were, you might be thinking, all right, well, that's only for the estrogen positive breast cancers because it's the hormones. Well, no, that's not the case. There's another study that found that estrogen negative cancers, women who drank milk had a 58% increase for breast cancer. So why would that be if it's not necessarily the hormones per se? Well, there is a component in dairy that's known as insulin-like growth factor that may be the risk for increased cancer. So there are some great alternatives now on the market that are now more readily available than they have been in the past, like almond milk, soy milk, coconut milk. You can even make your own milk at home, as I do. And feel free to put questions in the chat if you're kind of curious about any of these. I do want to make sure I'm able to answer your questions if you're feeling like why is the case. And then other foods to limit and what the research says. So processed meat. So there was a study of almost 300,000, well, 262,000 women from the UK, and they looked at this for over 7 years, where those women who consumed processed meats every day, and the amount they were consuming was less than half the size of a regular hot dog, so not that much, but they increased their risk by 21% compared to those who did not consume this. And the processed meat that they were looking at were things like bacon, ham, sausages, meat pies, kebabs, burgers, and chicken nuggets. And then the authors also saw that in 11 studies that, great question on the processed vegetarian meat. I'm going to tell you about that in a minute. So the 11 studies that they looked at overall found that the cancer risk and postmenopausal cancer risk increased with processed meat. So overall, it's bad. And the reason being because of heme iron, nitrates, nitrites, and heterocyclic amines. So there's these chemicals that are in there. So now I got a question from the attendees that does that include processed vegetarian meat? Well, the problem with processed vegetarian meat is it's processed food. So that's a different thing going on. We do know that processed food overall is not good for us. It does have a lot of chemicals in it. So your Beyond Burgers and your, let's see, whatever, there's like, I know there's like these chicken nuggets in the shelves now and all this kind of stuff, that's not real food at the end of the day. So one, your body is not getting the nutrients it needs. Two, you're still adding unhealthy processed. You might as well eat McDonald's. It's almost as equivalent to that. And it will cause cell damage. So Then how about grilled chicken? So you may see a lot of people who are like eating, grilled chicken for lunch, grilled chicken for dinner. It's keeping them slim and lean. They think of it as a great weight loss food because they need more protein. I gotta tell you, vegetables have protein, beans have protein, nuts have protein. But what does a grilled chicken have? Grilled chicken actually has a carcinogen that will worsen breast cancer. So there was research found that grilled chicken has something called PHIP. It is one of the groups of carcinogens that is found in grilled and barbecued meat, especially chicken. And what that happens to do is cause extracellular invasive behavior, meaning that you have the tumor localized maybe in the breast, but that grilled chicken was found to make it be extracellular going out of the breast, becoming more metastatic, worsening existing disease, and damaging that DNA. All processed foods are bad, whether complete or incomplete protein. Yes, most processed foods, I would have to agree. I want to mention, since we kind of jumped off onto protein for a second, a good source of complete protein for plant-based diets is quinoa. All right, that has all your amino acids, and amarnath, a similar grain, has all your amino acids. So now, all right, I started with the bad news, but what's the good news? The good news is, let's talk about all the different food we can eat. Because if you're like me, I love some good food. I love some good cooking. So the good news is plant-based foods increase breast cancer survival. There was 85 studies that looked at about 165 people diagnosed with breast cancer, and they found that eating more high fiber plant foods both before and after diagnosis reduced the risk of dying from breast cancer. So now, not only is it important in a perspective of preventing breast cancer, even those individuals who have been diagnosed will benefit from having more plants in their life. And then additionally, women who consume more soy after diagnosis have a lower risk of dying, while women who consumed more fat, especially saturated fat, before diagnosis had a higher risk of dying. So where do we find saturated fat? We find saturated fat in anything that comes from animal products. So whether that be meat or dairy, you're going to have saturated fat in there. And then other factors that boosted survival was regular exercise, maintaining a healthy body weight, and overall, there is a lot of research going on and more evidence showing that good food choices will improve survival. So now, if you don't have your pens and papers out, oh yes, we are going to talk about soy for sure. I'm going to explain to you. I see another question came in about soy. I'm going to get to that because that is a great question, and I do want to clarify the misinformation. So let's talk about the foods to consider for both breast prevention and for overall breast health and for breast cancer patients. So like I was saying, if you do not have your pen and paper out, or if you've got your cell phone in front of you, you can take some screenshots. You can write some of these down. If you want to take some screenshots, definitely tag me at Dr. Bahnote and share. But one of the first categories of foods I want you to consider is omega-3 rich foods. These are very protective, especially for postmenopausal women, but overall, it is part of an anti-inflammatory diet. And since most of us have quite a bit of inflammation in our bodies, these are going to be beneficial. So if you do choose to eat fish, that is a source of omega-3s. And the best choices would be things like salmon, anchovies, or salmon, sardines, and cod. would be your cold water fish. But flax seeds are very beneficial. You always want to have flax seeds ground. That is something that you can easily throw into a soup, a salad, a smoothie. Walnuts are a great source, olive oil, avocados, and flax seeds actually have been shown in animal studies to prevent breast cancer independently because they contain a component called lignin. And what it does is there's a mechanism for all these omega-3 rich foods that decrease inflammation in the body. So that's why they are beneficial. The next category of foods to consider is fiber. So fiber is associated with a decreased risk of breast cancer. 10 grams increase in daily fiber will decrease that 4%. Meaning that with every 10 grams you increase, you're going to decrease your risk. Okay. Now, most people, I will tell you, are not eating fiber. If you are somebody that suffers with constipation, you do not have enough fiber in your diet. Even if you don't suffer with constipation, more than likely, if you are not eating a lot of fruits and vegetables, you do not have fiber in your diet. Why not? Because guess what? Meat, dairy, and sugar do not contain fiber. So if that is something that is very heavy on your dietary intake, you are missing out not only to decrease your risk of many cancers, colon, breast, so many cancers, but also to help lower your cholesterol, which is another one of our chronic diseases that we deal with. Fiber will help you do that. So where can we get fiber? Legumes. So beans, we love our beans, so let's eat our beans. Nuts and seeds, fruit with skin on, and then vegetables. Now, how does that work exactly? It helps by controlling blood sugar, and it helps by decreasing estrogen levels. So, you know, I've mentioned estrogen quite a bit here, and, you know, I don't know if there's any younger women on this call who are probably like, well, I don't have to worry about breast cancer, but maybe you're dealing with some other estrogen related issues like PCOS, PMS, any of these kind of female hormonal fibroids, any of these female hormonal things. I do want you to keep in mind that those are linked with excess estrogen in our body. So how can we remove excess estrogen is to increase fiber and fiber rich foods. Next, all right, so soy. All right, my favorite topic. I could talk about soy all day long, and I do have an entire blog on soy. I should share my website with you guys, and you will find that on the blog, but let me tell you about soy and breast cancer. So soy actually has a protective effect and against breast cancer, and it's linked to high levels of isoflavones. The recommendation is actually to have 1 to 3 servings of soy a day in a balanced diet with other foods. Now, the soy I am talking about is a non-GMO or non-genetically modified tofu, edamame. So if you go to any Japanese restaurant, order your edamame, and then organic soy milk. Those are the sources that I'm talking about. I am not talking about soy chicken nuggets. I am not talking about protein bars that have soy in it. I'm not talking about soy burgers. Those are all processed and not healthy. But having real soy, I make tofu croutons instead of having breaded croutons, you know, or I'll just make tofu wraps. So there's a lot of things you can do with tofu. And the research shows that out of 5,000 survivors, soy food intake inversely was associated with breast cancer mortality and recurrence. What does that mean? That means that women who, after breast cancer survivors, when they included soy in their diet, they had decreased risk of mortality and the decreased risk of breast cancer coming back. And this benefit existed both for estrogen positive cancers and estrogen negative cancers, and both for users and non-users of tamoxifen. So where did this misinformation about soy come from? as far as I can see, it goes back to a article that came out in the New York Times where somebody had written something about how soy causes breast cancer, and the research that they quoted was not interpreted correctly, which means that when you are reading medical research, you want to make sure that you actually understand the research, which is not easy to understand in all honesty. So with that being said, the research that was done using something called soy protein isolate, and it was done using this chemically produced soy protein isolate in amounts that nobody would even consume in a week. I mean, like a ridiculous amount of soy, and not really real soy food. So the research was misinterpreted, and you know, as things go, when one person hears it and then it goes down and it goes down and it goes down. So the information really went down the wrong path. And so now women who could have really benefited from having tofu in their diet missed out, right? So there's no reason not to incorporate it. Now, I will tell you, I eat it almost on a daily basis. And I'm not afraid of it. Like I said, I've diagnosed enough cancers to know what I'm putting in my body, and I'm doing it for protective purposes as a woman. So hopefully, and so the other thing is the isoflavones in soy, they bind to specific beta receptors in the breast cells, as opposed to estrogen, which binds to alpha receptors. So that there's this whole, I should say, complex chemical pathway of why it is beneficial. And yes, tofu is good for you. And is estrogen in plants different from animal derived? So the estrogen in plants is called phytoestrogens. Phyto means plant, and yes, that is different. Animal-derived estrogens are usually artificially created. Now, if you think about the process of how milk is produced, just like humans, when moms have babies, they produce milk for a certain amount of time. However, when cows produce milk, the only way for them to continue producing milk is for them to be given artificial hormones. So they always remain in this cycle of producing milk. That is very unnatural. And so there's no way to take that out. Even if you see in the refrigerator section, you'll see like hormone-free milk and whatnot. You got to remember those milks also contain antibiotics, which is not good for our gut microbiome. And I'll talk to you a little bit about how the microbiome affects breast cancer development. So yeah, so many reasons not to drink dairy when you have so many other sources. And if you're not a fan of the taste of soy milk, I would recommend trying out some of the other ones like oat milk, coconut milk, rice milk. I find that oat milk is the one that works for me in my coffee because I like to get that kind of frothy taste, but then I will use almond milk in my baking, right? So try a few of these out to see what your preferences could be. And then how about other foods to consider? So crucifers. So crucifers are things like broccoli, cauliflower, kale, cabbage, Brussels sprouts, bok choy, watercress, radish, mustard, turnip, broccoli sprouts. When I joined this call a little bit earlier, I think you guys were talking about some of the greens at the top of these. So the top of the radish greens, the mustard greens, all these, eat them, saute them with a little bit of olive oil and garlic and eat them. So why does this work? So eating cruciferous rich foods is beneficial because it's rich in a compound called sulforaphane, flavones, and indole 3-carbinol, which these ingredients have anti-cancer compounds in them. And so that's why they are associated with a reduced breast cancer risk. Actually, for dinner tonight, I am going to have some brown, like I'm making a brown rice bowl with broccoli, and my broccoli's defrosting. So, and I already ate my tofu earlier. So, and so I want you to kind of keep in mind, and this is, you know, if you're like, I couldn't possibly eat another broccoli, it's like a tree. Maybe you have childhood nightmares of your parents trying to feed you broccoli. I would recommend trying broccoli sprouts. They are a lot lighter. They don't feel so heavy. You can throw them into your sandwiches, your salad. You can even grow them at home. I grow them on my kitchen countertop. So that might be a way to incorporate them. After that, we've got some other foods to consider. So how about mushrooms? So mushrooms contain medically active compounds with anti-inflammatory, immune-enhancing, and anti-cancer properties. So now when I'm talking about mushrooms, I am talking about things like shiitake, maitake, lion's mane, the Asian mushrooms. I am not talking about your baby bellas, your portobellas. I want you to upgrade to a Lamborghini style mushroom, which are your Asian mushrooms, as opposed to maybe like a Toyota mushroom, because that's where you're going to get the more of the health benefits from. And the thing about mushrooms is always eat them cooked. Never eat mushrooms raw, any kind of mushrooms, because they contain a toxin in them, which is not good for our health. And that toxin gets inactivated by cooking. And this is one of my biggest pet peeves of when I was living in New York, because I lived in New York for, I don't know, 15, 20 years, and all parts of New York, all the boroughs, all the upstate, everywhere. And every salad bar I went to, including the hospital salad bars, would have raw mushroom slices. Please do not eat those, okay? I don't want you to have unnecessary toxins in your body. And then I also mentioned garlic. Garlic has been showing some promise in studies, but garlic comes with a host of other benefits. So it's vital to include that in your meals. And then spinach, chard, and asparagus can help reduce breast cancer risk due to high concentrations of folate and antioxidant carotenoids. So those are some of the foods. Let me see if I have more foods to consider. Oh, I have a couple more, right? So no, that was my mushroom. So reishi, maitake, shiitake. And then how about some spices? So you may have heard about turmeric. Turmeric is shown to inhibit the growth of breast cancer cells induced by laboratory exposure to pesticides. So if you live in an environment where your neighbors' lawns are always getting sprayed, or you work somewhere where you're exposed to pesticides, you know, turmeric could be pretty beneficial. And this effect is synergistic with soy protein, meaning that when you put turmeric on your tofu, you have even a bigger anti-neoplastic or anti-cancer effect and anti-inflammatory. The other mechanism that turmeric does is it helps kill off bad cells. That's what increased apoptosis means. Apoptosis means to kill the cells, and it allows for prolonged cancer-free survival. Where can you incorporate turmeric? If you want to incorporate it into your foods, you can put it into curries. You can put fresh turmeric root into smoothies. You can throw it into soups. I put turmeric into ice cubes. So like in the summertime when I make flavored ice cubes, I do turmeric, lemon, ginger, and a little bit of black pepper, and turn these into ice cubes that I throw then into my water and sip throughout the day. So there's many kind of things you can do. And then how about some other foods to consider? So we got tea, okay? Tea is very powerful. Specifically green tea, the recommendation is to have at least 3 cups of green tea a day to reduce the risk of breast cancer recurrence. I have all my breast cancer patients drinking green tea. It's very high in antioxidants, and it can help with that oxidative stress that causes cell damage. And how about coffee? Well, there is a study that shows that drinking 3 cups of coffee was associated with decreased risk of postmenopausal cancer, but not premenopausal. So depending on your age, that might be something you want to consider, but definitely the tea, that's going to help everybody, both men and women. So I would recommend incorporating that. And then other foods to consider, blueberries. They have a compound called pterostilbene that is a potent inducer of antioxidant activity. So you've heard me talking about antioxidants quite a bit. I do a lot of in-depth blood testing on my patients, whether they're cancer patients or not, anybody with a health issue. And I can tell you most people are walking around antioxidant depleted. What are some antioxidants? Those are your vitamins A, C, E, your plant-based antioxidants, alpha lipoic acid, so many ingredients that are required to make the body work. And then how about strawberries and raspberries? They also have a potent antioxidant, and they are very helpful in detoxifying the liver from carcinogen chemicals, and they have been shown to slow breast cancer growth. So you can get like frozen berry bags, you know, which sometimes in the winter it's a little hard to get fresh berries. I know it was when I was living in New York. So even doing the frozen berry bags is a great way to incorporate them. Put them in your steel cut oats, put them in your smoothies. Just incorporate them however you can. So now I want to take a moment and pause before I go on to the next section. I just want to make sure with the pastor that I have enough time, and if it's okay if I continue, because the remainder of my talk is on breast cancer, but it's not on the nutritious side. It's more on the sleep and toxin exposure side. So I want to make sure that I can provide that to you, but somebody let me know if that's okay, if I can continue for a little bit.
You can take all the time you want, and
Yes, go right ahead.
Okay, thank you. Thank you. All right, so let's talk about sleep. No, crustaceans are different than mushrooms. Mushrooms are their own family of fungi. All right, so what's sleep have to do with cancer? Well, lack of sleep is linked to a higher risk of estrogen positive postmenopausal breast cancer. People who do not get enough sleep have lower melatonin levels. When you have lower melatonin levels, that leads to breast cancer cell growth, and that the repair is less likely to happen. So how do you get better sleep, whether that's for breast cancer prevention or just overall health? How do you want to get a good night's sleep? Well, I want to remind you that your bed is for 2 things. It's basically for sleep and sex. Okay? Try not to read, watch TV, talk on your phone, check your emails, log into Facebook, or do work in bed. Maintain a regular sleep-wake cycle. What that means is waking up at the same time every day, going to bed at the same time every day, as close to as possible as you can. Try not to take a nap. Because that will disturb your nightly sleep if you take it too close to bedtime. Avoid caffeine, alcohol, heavy, spicy, sugary foods 4 to 6 hours before you go to bed. They can disrupt your sleep cycle. Alcohol and sleep. So some people like to have a nightcap with their dinner. They're like, it helps them relax, it helps them fall asleep. What actually happens is, yes, it will help you fall asleep, but it doesn't allow you to go through all the stages of sleep, and it disrupts that sleep cycle. So when you're later in your sleep, you're not getting through stage 1, 2, 3, 4. And when you don't get to that deep sleep is where your body repairs itself. That's where your brain removes excess damage that's occurred, cell damage that's occurred, proteins that have been misconfabulated are all removed from the body. So if your body is not getting the sleep that you're needing, the damage that is created does not get a chance to be removed from the body. If you have a problem with sleeping, maybe consider when you're exercising. You don't want to do it right before bed because that could increase change in your body temperature. Exercise in the morning or afternoon can help you sleep more deeply. And make your bedroom as comfortable as possible. Keep the bedroom at a comfortable temperature and block out light. And then we do need to think about the psychological quality of life, mind-body. Mind-body has a potential and critical role in any disease, okay? So reducing stress, I know that people who have been diagnosed with breast cancer do report sleep deprivation, whether that's due to their medications or just the anxiety of it. And even 25% report symptoms of PTSD. So how can you address this? Consider things like guided imagery, music therapy, mindfulness. We started today's meeting when I came on with a mindful minute. All it takes is a minute to get into that parasympathetic state. Yoga, progressive muscle relaxation, breath work, and even EFT, also known as emotional freedom technique or tapping, can be very beneficial. Now, how about toxin exposure? So breast cancer is really the result of a complex interplay between your genetics and your environment. So things that aren't inherited through your DNA are your lifetime of whatever you're doing, your growth, your development, your nutritional choices, biologic chemical exposures, the amount of physical activity, your social and cultural experiences. Those are not inherited, but those still yet affect the development of diseases, including breast cancer. One of the bigger culprits is something called endocrine disrupting chemicals. And this is a natural occurring and man-made group of chemicals. They are things like pesticides, plastics, BPA, phthalates. Phthalates are associated with breast cancer, and they are found in an abundance of personal care and household products. So if you are somebody who likes to spend your time at Ulta or Sephora and go and try on your makeup and all that stuff, or at a beauty salon, I want you to keep in mind the products that you are using and if they can be adjusted to be more natural, chemical-free, phthalate-free, because that will help reduce your risk of any hormonal-related diseases. And then other things for toxin exposure, basically there's some professions that are linked with higher risk of toxins. They might be people who are nurses, teachers, librarians, first responders, food or beverage workers, hairdressers and cosmetologists, doctors, flight attendants, dry cleaning workers, paper mill workers, anybody working with plastics or textiles have an increased risk of toxin exposure. So how can you reduce your risk of toxic exposure? This is the most important thing. I would recommend taking a screenshot of this because this is a lot of information. So if you choose to eat meat, eat hormone-free meat and dairy, avoid charred foods, especially meats. When meat is barbecued, it changes the protein into heterocyclic amines, which is toxic and carcinogen. This does not happen to vegetables on the grill. So you can turn carrots into hot dogs. You can put carrots on the grill. You can put peppers on the grill. You can do lots of things. Use stainless steel or glass containers. Stay away from Tupperware, plastic water bottles, anything plastic. And if you do have plastic, do not put plastic in the microwave or in the dishwasher. It does break down. Eliminate those phthalate-containing household toys, personal care products. Another big one is fragrance. I remember growing up where it was like, all right, what is Macy's having for their big sale for holiday time? And you buy the cologne for your dad and you buy the perfume for your mom. I wish I would have known this. But anything with fragrance, and fragrance comes in like over 50 different names, does contain chemicals in it, which is not good for our health. So think of using things like maybe essential oils as a more natural way of using scents, non-toxic cleaning products, water filters to remove chemicals, avoiding car exhaust as much as you can, washing hands frequently, eating fish low in mercury, removing your shoes when you come in the house, avoiding carpet and furniture when possible, limiting exposure to wood burning fires, and eliminating pesticides and around the home is recommended. So now let me see. Okay, we got just a couple more slides left. Intermittent fasting. So intermittent fasting is something like time restricted eating, meaning you may eat your meals within an 8-hour window. Maybe you eat from 11 to 7 every day, but what you're eating during that window is nutrient dense, healthy food. Now, breast cancer is one of the cancers that is sensitive to obesity and fat consumption, right? Therefore, weight loss strategies can be beneficial. Now, with intermittent fasting, if you do choose to eat that way, the reason it works is because there is a role of insulin and glucose in the growth of breast cancer. So when we do that, we're able to better balance our insulin and insulin production. So we know that intermittent fasting is a successful weight loss strategy. We know that we can use its effects to reduce the risk of breast cancer, especially even after treatment. We know that when we have metabolic disturbances of too much insulin and blood sugar, it increases the risk of breast cancer coming back. And so the recommendation is, if you can, to try a 13-hour fast to help with that regulation. I do intermittent fasting. It has really been beneficial for me for afternoon headaches. It keeps my brain clearer and more focused. So it might be something you want to consider. It is not recommended in pregnancy, or if you do have an eating disorder, I would recommend consulting with your physician. So keep that in mind. And then the microbiome. So we have a microbiome, which is, we actually have more gut bacteria in our body than we have cells. So now we are learning more and more about how that gut bacteria is linked to different diseases. It's pretty much linked to a lot of diseases, from autoimmune diseases to metabolic diseases to depression to cancer. So now we are learning that there is a subpopulation of the gut bacteria called estrobolome. And these are the ones that are responsible for metabolizing estrogen. And if you don't have them, or you have an imbalance of them, meaning you don't have enough, they can increase your risk or affect your risk of developing a estrogen receptor breast cancer in postmenopausal women. So it is pretty interesting to see some of the newer research that is coming out on that. Yes, so I just, before I give a summary here, I do see a note in there, vitamin D deficiency, absolutely. So there's a great study out of University of Rochester, where one of the places that I train, that low levels of vitamin D are linked to an increased risk of breast cancer. Now, as people of color, I am a person of color, and I don't have the levels of vitamin D, even though I'm in Florida and I'm in the sun all the time. My body just doesn't create that, right? So we don't absorb it as well. Your doctor might be okay with, oh, your vitamin D is 28, 29, you know, you're not quite deficient, you're fine with it. Breast cancer patients and most patients I keep at a level of 50 to 60. There's a difference between a level that is considered sufficient versus a level that is considered optimal for health. I do want you to keep in mind that when lab tests are validated and compared, they're compared to what or they're validated compared to what they think is a person without symptoms, but not necessarily a person that's disease free, right? So there's a lot that goes into that, and that's where, you know, more in-depth testing is important. You can get your vitamin D tested at some of these labs that just do cash pay testing for about $25. It's definitely worth it. If you have insurance charges, I think the last time I checked, Quest and LabCorp charge around $200. It's kind of too much. And if you do it more than once, they will charge you even more, because the idea with insurance companies is that if you had it tested once and you started supplementing, that it should go up, but that is not the case. Vitamin D is a fat soluble vitamin, which means that if you take too much of it, it could become toxic for your body. If you have too little of it, it's also not good for your body. Any of the fat soluble vitamins, D, E, A, and K, like to sit in fat. So if you have more adipose, it could change the amount of vitamin D that you take. You always want to have that calculated by your doctor based off of your intake of vitamin D supplementation, your body weight, and what your actual blood test shows. So keep that in mind. So what are the guidelines? So we have the American Cancer Society that recommends increasing intake of fiber in the form of fruits, vegetables, and whole grains, maintaining a healthy weight, regular exercise, 2 to 3 hours of walking a week, reduce the mortality by 45%. That sounds pretty good to me, right? 2 to 3 hours of walking a week. Let's do it to decrease that risk. A low-fat diet had no effect on mortality. However, a high-fat diet did increase cancer and non-cancer mortality. So I'm not a fan of low-fat replacements for food, like low-fat dairy, low-fat, because what's happening is they're replacing it with something else that our body does not like and our body cannot use. Our body likes fat, especially our brain loves fat. So the fat that I'm talking about is things that you're going to find in avocados, nuts, and seeds. So the more whole foods kinds of fats. And then the European recommendation is obviously no smoking, having a BMI less than 30, and they're recommending 3.5 hours of exercise a week, healthy plant-based diet, and that can reduce the risk of cancer by 36%. So there are additional resources on my website. I do have a plant-based gluten-free cookbook available for you for free. If you want to download that, I'll throw the link in the chat for anybody who's on the computer. So that is available for you. And then, of course, a lot of the stuff that I talk about, how to improve your cellular health and kind of regain control of your body and how your body actually functions, I talk about in my book, which is available in Amazon, as I mentioned. And then you can always connect with me. My website is drbahnote.com, and on social media, I am Dr. Bahnote. So that's a really easy way. So let's see, let's look at some of these questions here. Let me just go backwards. What about gummy vitamins? There's so much of them on the market. Yes, gummy vitamins are full of sugar, but it's not just the sugar that is the problem in gummy vitamins. When you're taking any kind of supplementation, you really need to be able to understand how much % of it your body is using and how much your body needs, right? So I will tell you that most people are deficient in a lot of vitamins because I test every vitamin before I put a patient on supplements. But most of my patients come to me, they're on 20 supplements, 20 bottles, and they line them up on my desk. And I'm like, okay, then we do the blood work. None of those supplements are working for them. Most of them have fillers in them. Most of them are not the right dosage. And 19 of 20 of those bottles go in what I call the supplement graveyard or the trash can next to my desk. Because people just supplements is a very complex thing to understand. So you do want to work with your doctor on supplementation. what are my top 3 supplements to go to? A high quality multivitamin would be one. A high quality omega-3. I use an algae based omega-3 because I am plant-based, gluten-free. And then the third one would be a vitamin D. So those are my 3 kind of go-tos for most people, would benefit from those. Let's see. Someone who dyed her hair, had bulking eyes, and very low oxygen, had to be rushed to emergency. The doctor told her to die or told her to die or die. I'm not sure what that means, Genevieve. If you want to tell me a little bit more about what that means, I'm happy to go further into that. I'm not sure I understand the question there. Vitamin D deficiency, yeah, it's quite common in African Americans. Like I said, anybody with skin like a darker skin color will be have a likelihood of being deficient. There's another thing is that you might have a gene that doesn't allow you to convert the vitamin D. I just recently found out I have that gene, which meant that's why I take a certain dosage of vitamin D in order for it to get to that level. So you could blindly be taking, 1,000 IU or 10,000 IU and not know if it works. So definitely you want to get that checked. Chemicals in hair dye and relaxers linked to uterine. Yeah. So that's where we go back to those chemicals, which are the endocrine disrupting chemicals in hair dyes, relaxers, things like that. So consider, things like using coconut oil, or there is like, in my culture, we use henna and indigo, which is a plant-based dye for hair. So do keep those in mind and really search out alternatives, especially if you've been using them for years. Or just it's very fashionable now to bring out the gray. I mean, everybody's looking beautiful with their gray hair. So yeah. How about bras we wear? So the bras, the research has not proven with the bras that there's anything to worry about with the underwire bra or anything like that. Now, I would caution people about breast implants. Not necessarily because of the breast cancer risk of breast implants, but really when you have breast implants, getting mammography is much more challenging. People with breast implants can still get breast cancer. And we see a lot of women, I know I'm working with quite a few women in their 20s and 30s who are going through explants because it is causing health issues that are pretty complex, but nobody can pinpoint what they are, and nobody wants to say that they're the breast implants. But once they get the implants out, a lot of their fatigue, energy, all these kind of mysterious things start going away. So something to consider. Aluminum in deodorant has been questionable. I do recommend any beauty products. Clean beauty is very important. Aluminum foil, I stopped using. You can test aluminum in your body, so it is worth testing. Not just aluminum foil. I want you to keep in mind the pots and pans you are cooking with. To consider using stainless steel, cast iron if you do not have a problem with iron in your body. Or even ceramic. Stay away from the Teflon or the chemical ones. They also kind of end up in our food, which is not good. Porcelain, yeah. So porcelain is the ceramic, yeah. So ceramic is okay. I just changed out a lot of my pans. I use a company called Green Pan. That is pretty good because the food doesn't stick to it. So that's a good one. Yeah. Anybody else have any questions? Encourage breastfeeding. Yes, absolutely. So breastfeeding is protective. I don't know if you recall in one of the first slides that I had, one of the risk factors for increased breast cancer risk is nulliparity, which means not ever being pregnant, and not ever breastfeeding. So yes, breastfeeding is recommended, not only for the mom, but also for the baby. The nutrients that are passed on to the baby is really important for the baby's immune health. Any other questions? I love these questions. You guys are great. I would love to see your faces. Okay, how about salt fish? So one, you want to know what is the fish. You want to know if it has a lot of mercury in it. Do not be afraid to get your mercury tested. Where I live in Florida, there's a very popular seafood area, and almost all my patients have elevated mercury, elevated so much that the Florida Department of Health calls me. And actually, no, I have a patient in New York where the New York Department of Health called me. Oh, hers wasn't mercury, hers was arsenic. She had elevated levels of arsenic in her body. And that reminds me, if you are using medicinal marijuana, be careful where you're getting it from, because you want to make sure that it does not have arsenic in it. That was her source of arsenic, because she was using medicinal marijuana for pain. So do be careful with that. But salt fish, I would be concerned about the elevated amounts of sodium in there, especially if you have a blood pressure issue. We tend to get more sodium than we need in our body. When we have too much sodium, our body does not like it. Do I recommend canned sardines? It depends where you're getting them from. I personally don't really recommend seafood that often, unless, you know, we're switching from a standard American diet, which I could go on and on. Actually, I do in my book, and talk about the standard American diet, because that's what mostly people are eating. Now, seafood, you have to keep in mind that our fish are swimming in the ocean, and our ocean is full of plastic. So when the fish eat the plastic and we eat the fish, we eat the plastics. Remember I was telling you that plastic is linked to the chemicals that cause the endocrine disrupting diseases. So do keep that in mind. Treatment, naturopathic modalities for treatment versus chemo and radiation. So this is a tough one here. I will tell you, as somebody who has diagnosed so many breast cancers, it is really important for me to share that once you have breast cancer, depending on which one it is, I would want it, if it was my mother, my sister, I would want it treated with surgery, chemo, and radiation, depending on which of the cancers it was. I would not go down the route of avoiding that once I had the cancer. But as for other things to do, I definitely think you have more power than you think, in the sense of your lifestyle, right? So when I've worked at a lot of cancer centers, you know, where they have the little bell to ring after you've completed your chemotherapy treatment and whatnot. Well, one of the cancer centers I was working at would have Chick-fil-A delivered every time that happened. And I'm like, grilled chicken, no. Like, what are you people not getting? That is not something we want to give a patient who just finished her cancer treatment, let alone had to go through that. So I really want you to be your own advocate when it comes to your health. Think about it, you know, like, let's get off autopilot and really think about what we're doing with our body, because I think we can all do a lot better, and it does not need to be that hard. One of the other things, I'm not encouraging coffee per se, Rebecca. I'm just giving you some of the information for the people who do drink coffee around breast cancer, and that it's not necessarily a bad thing, right? One of the other things I do is, I did not share that I am a culinary medicine chef, means that I teach people how to eat and heal their body. So if that is something, and I do that online, if you're interested in, it's on my website as well. It's called the Lifestyle Design Lab, the next cohort starting in 2023 after the holidays. So of course you can join me for my live cooking classes, and you will always see the puppy on the screen because she hangs out with me when I teach. So any other questions?
Yeah, there's another one that I think you missed about the white blood cells.
About the what?
White blood says, what causes the white blood count to get lower, leading to autoimmune disease?
Yeah, so white blood cells, so chemotherapy kills cells basically, okay? And it's not necessarily selective. It will also impact your white blood cells. So you will see that most people will be getting, every time they get an infusion, they're checking them for neutropenia to see is their white count lowering and lowering. When your white count lowers, that obviously puts you at increased risk for infection. But the other thing that we are seeing with breast cancer quite a bit is that autoimmune diseases start flaring up or become present, meaning a lot of people I see after breast cancer treatment develop autoimmune Hashimoto's thyroiditis is a big one. So they develop thyroid disease, and that's basically your body is fighting against itself. Where I kind of go with that is most diseases start in the gut. So if our gut is healthy, meaning we're moving our bowels, we're absorbing the nutrients from good whole foods, we can prevent a lot of diseases. When our gut is not healthy, the lining of the gut allows toxins to enter. It allows, for some people, even gluten can be a toxin, and that enters. And when those toxins enter into our bloodstream, they go to other parts of the body, contributing to disease. So do keep that in mind. Really, really take a look at your gut health for any diseases you're dealing with. Do I think the jab has contributed to some of the increased rates of cancers and many more illnesses? I can't say for cancers. I have not seen that for cancers. I have seen patients who have health issues after getting vaccinated. Yes, I have seen that, but not cancer. I do think we will see increased rates of cancer because people were home for 2 years and were not able to get adequate screening and adequate testing. I do think we're going to see an increase of that. And also, one of the things to keep in mind is that our immune system plays such a large role in how we address diseases, meaning we're developing cancer cells every day, all of us, but some of us are able to fight it off more. So when your immune system is healthy and you can fight it off, then it kind of just goes away. But this 2-year period of our mental health has definitely affected our immune system. So that's why I want you to keep in mind ways to improve your mental health, whether that's going outside for a walk, being with your congregation, just being around people who are uplifting is going to be really important for your immune health.
How about nightshades for menopausal women?
Yeah, nightshades. So nightshades would be, for people who don't know what nightshades are, those are things like tomatoes, potatoes, eggplant. Not concerning per se for postmenopausal women. There is some people who deal with autoimmune thyroiditis do better off of nightshades. When I'm working with individuals, what we usually do is we start with an elimination diet, meaning we remove the nightshades as a last resort after we've done everything else, and then we reintroduce one nightshade at a time. So what's the one that they might want to eat the most? Maybe they want to eat tomatoes because they like pizza and pasta, right? We reintroduce that for a week. We see how their body responds. We check their blood work. We see what's going on. Maybe they want to eat French fries. We reintroduce that next week, So elimination diets are a great way to figure out, because we're also looking at symptoms. And when you think of gut health, I don't want you to just think of gut symptoms like constipation, bloating, things like that. I want you to think of, how is your skin? Is your skin glowing? Is your skin getting eczema? I want you to think of your brain. Are you getting headaches? Are you getting brain fog? I want you to think of your energy. Are you feeling fatigued? So there's so much to think about when we're trying to experiment with different foods and what works for us. And it's really getting a personalized approach. There's no one size fits all for everybody. So hopefully that answered that for you, Carmen. Oh, I can't hear you.
People are saying that, you know, it's almost impossible to eat well. You have to buy food in the can. Okay.
The can?
Yeah. You know, if you can't get stuff, you have to buy it in the can. And I think I'd like to have you address that one. Is it really necessary? How can people eat well on a small budget?
Absolutely. Okay. So eating well on a small budget, great question. Frozen foods is some of my favorite ways to eat well, right? Because one, they're at peak ripeness. You're going to get the most nutrients from them.
Recording in progress.
They are also cost effective in the sense, like you can get a pretty good bag of broccoli for $2, $3, right? So frozen foods are really time cost effective and nutrient dense. Beans you can get like not canned, right? And those are going to be more nutritious. If you don't have an Instapot or a crock pot, something that you can cook and walk away from, that is worth an investment, right? Because I am a person who is super busy, but I can make my meals in 10 minutes with
Recording stopped.
From 5 to 7 to 10 vegetables in one meal, because I've got all these different sources. Things about herbs and spices are a great way to incorporate nutrients. I know some of my patients always complain like, oh, I bought cilantro and it went bad. I bought basil and it went bad. So I give them this little secret. I'm like, when you get your herbs for the first 2 days, eat them fresh. The next 2 days, turn them into a green sauce, meaning take your bunch of herbs, put it in a blender with 2 cloves of garlic, a quarter cup of olive oil, and you can make a nice chimichurri sauce with cilantro. You can make a nice gremolata sauce with parsley. Make these little green sauces, pour it over your vegetables, pour it over your brown rice, pour it over your tofu. And then that remainder of that sauce, 2 days later, stick it into the big whiskey size ice cube trays. So that way, when you're like, I don't have the energy to cook after I've worked, you pop them out of the ice cube tray, you put them in your saute pan, saute up some vegetables, and you've got a quick meal to go. So there is ways to do it. There is ways to do it.
Great, thank you. You've got more questions.
Yeah, let's see what these questions are. What are some of the ways by which the breast may be exercised? So breast exercise, well, I do recommend you doing self breast exams. The best place to do self breast exams is in 2 places I like to do them. One is before you go into the shower and you're undressed in the mirror, raise your arms up above your head, look at your skin, look for any dimpling, but get familiar with your breasts, okay? And then another place to do them was when you're in the shower, right? So when you got your soap bar and stuff, but also massage around there. Now, is there any exercises per se to do? Well, really, the breast is made of fibrous tissue, ductal cells, and adipose, meaning fat. You might be like, well, I used to have firm breasts when I was like 30, and then I hit 50, and then they got droopy. Well, that's because when you lose estrogen, the cells turn from certain cells to then fat cells. So your fibrous tissue becomes less, your fat tissue becomes more. I think as long as you're keeping your breasts healthy, I wouldn't worry so much about that, and checking your breasts for masses is very important. Let's see. Do I think annual mammogram is an effective preventive measure for breast cancer? when they are exposed to radiation, which is very dangerous for breast nodules. The breast is very sensitive and delicate. Yeah, okay. So mammograms, I do recommend mammograms depending on your risk factors, family risk factors, your age, annual mammograms. They can find a lot of things. The amount of radiation for them compared to the adverse of having a breast cancer, to me, that outweighs it, getting the mammogram. Now, I know some people question, oh, when I get a mammogram and it compresses my breast, that it might spread the tumor. That does not happen. I can tell you that. I've had enough surgical breasts in my hand, meaning breast tissue that's been removed from breast cancer patients, to tell you that's not the way tissue works. So I wouldn't worry about that. I know there's a lot of people talking about thermography, which is like some heat kind of testing that actually can show some misinformation. So to me, it's the safest thing is to get a mammogram. Let's see. Yeah, mammograms lead to early diagnosis. Yeah, not prevention. Yep, they're more for early diagnosis. And the thing about breast cancer is, God forbid anyone gets it, but you do want it early, right? Because once it leaves the breast or it's more aggressive, it goes to your lymph nodes, your lung, your brain, the treatment changes. It becomes a lot harder. And, you know, my whole purpose of writing this book was really because I want you to understand how the body works and how much control you actually have over the body, because you can prevent a lot of diseases. Do not give up that control for anyone. Take care of your body. Breast cancer. So if somebody has pain in the breast, I will tell you that breast cancer is not something that is painful usually, okay? So if it's pain, it's usually a breast cyst. Sometimes, most of the time it's like a cyst. The only types of breast cancer that are painful are the ones that are inflammatory type, but you're gonna see those because inflammatory type is a highest stage breast cancer, and the skin of the breast ends up being red hot and looks like an orange, basically, where it gets like that dimpling stuff in. So it's a different type of breast cancer. So you will know that. So keep that in mind. I do not recommend any alternatives to mammograms. I do recommend, if you do have dense breast tissue, to ask for something called it's like a high resolution mammogram. So instead of like a 2D where you see it, it's like this machine that almost spins around it and it can see things in more levels and slices. I always ask for that one. And now most insurance companies are covering that. I don't know about that, Robert. All right. Let's see. I think that's it. Any other questions? Oh, wait, let's see. Can you talk about breast cancer for men? Yeah, absolutely. So I have diagnosed breast cancer in men. So it's the same thing, right? So breast cancer in men, I told you, like, it happened. They get the same kind. They can get ER, they can get PR, HER2, they can get the same kind. So now doing a breast exam on a man should be easier, right? Because technically you don't have as much tissue. So you want to do breast exams on yourself. Listen, we want to become very familiar with our bodies. Look at your body in the mirror, but look at your body with some love. You know, don't look at it like, oh, I have cellulite or I have the, look at your body with love and really get to know your body, because then you can understand, all right, is this something that I need to show my doctor? Was this here, 2 months ago? Really, really pay attention to your body. And it's the same thing with the increased risk. Family risk will increase the risk for men as well. The modifiable risk factors are the same. For dense breasts, yeah. So in addition to 3D mammograms, you can get ultrasounds. So ultrasounds are usually done, and there's no risk of radiation with ultrasounds. Is if they see something on there that they want to compress a little bit more. Sometimes, depending on how dense your breasts are, they might recommend MRIs for your breasts, and especially if you have implants, they might recommend that because then you're face down and they can get to that back wall behind the implant. Why is there, okay, so why would one breast be bigger than the other? That's nature, okay? Unless there's a mass there, I do want you to check, but that's where I'm saying get familiar with your body. Has it always been this way? Is there something palpable there? If you look at your hands, you might see that your nails are different sizes on one side of the other hand. That's just human nature. Is there a cutoff age for annual mammo? No, we don't really have a cutoff range. And let me tell you, there is, depending on who you ask, whether it's the American Cancer Society or the NCCN guidelines or ACOG, the American College of Obstetrics and Gynecology, everyone has different criteria for when to start mammograms, and nobody can agree on when to stop. So this is something you want to work with your healthcare provider on. And your risk. You want to look at your risk factors, your overall risk of developing it. But like I said, my youngest has been 18 and my oldest, in the 90s. What do I like best about my work? I love teaching people. I love helping people. I think that the beauty of, what's possible now is how I trained 30 years ago is not how I'm practicing now, because what I trained in before, this wasn't available. So I went back and I did additional trainings, because after diagnosing 1 million cancers and reading patients' charts, and realizing it was not the genetics that was causing this, and it was what we have power to do in our lifestyle. I want you to know that. That's why I teach about lifestyle. That's why I teach about nutrition. That's why I teach about the power of plants and the power of food. I would recommend that if you are somebody who is dealing with breast cancer and needs a little bit more encouragement, I am on the clinical advisory board for Let's Beat Breast Cancer, for a Physicians Committee for Responsible Medicine. And then every year we put out a lot of information, and we do events for our breast cancer patients on plant-based eating and the importance of it. So that's a great resource for you as well.
Thank you. That's fabulous. Fabulous.
All right. Thank you, Carmen. Any other questions? Why doesn't the healthcare system educate more of the patients? Yeah. So I want you to understand that our healthcare system at the end of the day is a business like any other. Okay? It is a business. It is in the business of sick care, meaning we keep people sick to keep the business going. If everybody got healthy, hospitals would be out of business, insurance companies would be out of business, pharmaceutical companies would be out of business. I am not concerned about being out of business. I am not, because my heart tells me I'm doing the right thing. So that is part of it. Second part is doctors do not have the time to talk to patients about nutrition, lifestyle factors, because their practice administrators do not give it to them. Nutrition is reimbursed at $15 by the CMS Medicare, and that's why most insurance companies go with whatever CMS or Medicare guidelines are. So a hospital is going to get paid more for having you come back, having you have surgery. It's the truth of the matter, right? So this is where I say, you know, you have to take care of your body. Do not go into the hospital if you don't have to. Take care of your body every day. Wake up, get out in the sun, take a walk, exercise, eat right, sleep well. Take care of your body. It's a lot harder when you're sick. I promise you that. It is so hard once you get sick. But even then, if you do get sick, continue to take care of your body because you don't want to end up back in the hospital. I can't say it more than enough. Any other questions? Nutrition is a word that healthcare professionals don't use. Yeah, it's true. This is why I teach cooking classes. In my community, I teach them locally. I teach plant-based cooking classes pretty much in everything: gut health, brain health, cancer health. And I teach them online as well, because to me that is, if you, like I said, if you understand how your body works and that the fuel your body needs comes from your food, that you will start thinking of food differently. And I'm going to leave you with one example here. I'll give you an example that I put in the book. So I want you, and we'll close this out with a little meditation too. So close your eyes and think for a minute that you are sitting at a beautiful lake. Maybe you are at Lake Tahoe. Okay, you're on vacation with your family at Lake Tahoe. You are looking at this clear, beautiful water. The trees there are just bright, lush green. You've got your feet in the water. You look down, you can see the rocks. You see these little fish swimming by. And it's just so beautiful. You feel like it's just this amazing thing. You spend the day there. It's a beautiful day with your family. It's a beautiful experience. And then you see a sign as you're exiting. And the sign says, well, this lake has now been designated as a dump. It's been designated as a refuse dump. So the next day you go back and you see all of a sudden now there's plastic water bottles in here. There's garbage in here. There's refuse. And you see that clear blue lake is no longer clear. It's murky. It's dark. The fish are no longer being seen. They're dead off to the side. The green plants, the trees, everything you were looking at, it's not green anymore. It's dried up, brown, shriveled. The garbage has taken over. And even the smell is just awful, right? So I'm giving you this example of this lake because I want you to think of your body as this pristine environment, okay? This ecosystem that you have, and it is your responsibility to nourish this ecosystem to the best of your ability. So you give it clean water, you give it clean food, you don't tarnish it with processed food. This is what's going to keep your ecosystem and your cells healthy. That's what I want you to do. That's the message I want you to take, that you really have the power. So thank you so much, everybody, for this evening. I really enjoyed spending time with you. I hope you learned a lot.
Yes, thank you so much. As a matter of fact, I'm thinking, I'm going to suggest to Pastor Wright to have you come and do something at the church for us. This is wonderful in the community. This is great information. And I think for a lot of people, when we see it ourselves, it makes a very big difference. And if we can see and taste, as the Bible says, see and taste and see that the Lord is good. And we want to see what Dr. Monisha can do for us. Thank you so much.
You're very welcome. You're very welcome. Thank you so much. I hope you guys have a wonderful rest of your evening. And Pastor Wright knows how to get a hold of me. And any questions, send them my way. You have plenty of resources. I gave you my plant-based cookbook. I'm going to tell you this. Even if you're not plant-based or gluten-free, I will tell you all those recipes in there are quick, easy to make, and I've made them in all the cooking classes with non-plant-based eaters. And they love them. They're like, these are really good. So definitely.
That's awesome. Awesome.
Take advantage of that. And then, of course, my book is on Amazon if you want to learn more. So thank you. Thank you. Blessings. Thank you. Thank you very much.
Yeah, thank you, Doc. That has been, it has been a wonderful evening with you. We spent good parts of nearly 2 hours with you. And it was
I sometimes go on and on.
Yes. No, well, I didn't know that you could run 100 meters and also do 400 meters. I thought you're just good at 100 meters, but you actually can do a lot longer than 100-meter runs. And we appreciate that. And your little dog, what's the name of the dog?
Oh, yes. This is Miss Zara right here.
Oh, Miss Zara. Wow.
She was pretty good. I didn't have to like hold her until.
She behaved well. She didn't need a spanking at all.
Yeah, she was pretty good on the desk.
Very well. You trained her well, and she didn't let you down. You know, we train our children well, and then they let us down in big spots. But she came through. Tara did a good job. You almost called the dog Tarzan, but that's okay. Yeah. So we're going to wrap this up. Yes. Yes. Hold a second. Yes. Go ahead.
Pastor, before Doctor goes, I just wanted her to know that she had also with her folks that, for example, Dr. Karine Brownhall and Dr. Merle McIntosh, my breast cancer surgeon, was actually there and gave some invaluable questions asked. So thank them so much for coming.
Oh, Monisha, you heard that?
No, I'm sorry. I didn't quite understand. I didn't quite hear that.
Yeah, that's my wife. That's my wife. So that's my boss speaking.
Oh,
she's at home.
What did your boss say?
No, I was just saying that in the participants this evening, we were really blessed to have Dr. Karine Hall Brown, who is a naturopathic doctor herself. She has been with us already too. And Dr. Merle McIntosh, the best breast cancer surgeon in the world. And they really did ask some invaluable questions to inform the audience. So I thank you so much. And that was a phenomenal presentation. Really. Thank you.
Thank you. Thank you.
And I'm one of the few men who listened in. Thank you so much, my dear.
Thank you.
Yeah, well, Robert, you have to go examine your breast tonight.
I've been trying. That's why I asked the question, how can we exercise them? Babies sucking on them or other people doing that, you know? But nobody answered that. Nobody answered that part.
Oh, no, I saw it. I just don't think that will work.
All right. That's good.
That's good humor. And it's not a rumor that we need to examine our breasts, men and women. So, Doc, you did it. You did it. We will be in touch with you in many ways. And we're going to have to get you back here because I can tell that you have stirred up some interest and that you have executed with great agility and dexterity. And thank you so much for a very pleasant evening.
Thank you. Thank you. Have a good evening, everyone.
I hope you're still planning to give away one of your books. I hope so.
Oh, yes, yes. Ernie, who gets the book? You know what? Do you want me to pick somebody?
Yes, pick someone. That's fine.
All right. Well, okay. So let's see. I usually pick people who ask lots of questions because then I know they've got lots of questions. So let's see if I go through this. Let me see whose name comes up the most. Let's see. We got. Let's see. Let's see. Oh. Let's see who's going to win this. I'm going to go with Oh my goodness, there's so many questions here.
Could I give a suggestion?
Yes, yes. Cheryl, do you have somebody who reads this book that you think truly would benefit from it?
Could you give it to the church library and we rotate it?
Brilliant.
That's a good idea.
Brilliant idea. I think that's a beautiful idea. Absolutely. I will even sign it for the church library. And so I will do that, and I will be in touch with Pastor Wright on where to ship it to. That is beautiful.
Okay.
Thank you. God bless you.
Thank you.
That was beautiful. I want to thank Bobby and his lovely wife for helping me make this happen this evening. Really appreciate it. And Bobby and his wife, Keisha, are right here in the audience, listening and watching. They didn't move 1 minute. They didn't even go to the restroom. They were so seriously into it. And we really appreciate their presence here today. And I want to thank my wife also for promoting breast cancer awareness. She's been a student of this, not only theoretically, but literally a breast cancer survivor. And good to have all of you on today. And I pray that you will be more meticulous and serious about making sure that you make a preemptive strike against cancer by eating well and exercising and doing all the things that you need to do to make sure that if you get it, it's not because you didn't try. You know, you want to make sure you do all the things to prevent it as much as you possibly can. And of course, prayer can help the process, but you don't want to pray alone and do nothing. You know, that's like presumption. You want to, you know, do the job and keep praying, and hopefully you will get through it successfully. Thank you all for being such a wonderful witnessing audience, and thank you for coming on to our program each week. I just got a call, Dr. Bahnote, from one of the individuals on the program stating how much he appreciates the lovely programs we have in terms of educational programs every week. So we will be here for you, and we hope you appreciate it. Please remember to go to rptworship.com, rptworship.com, and you can always send $50, $100, whatever you want to send. $1, we take it. But we would like you to feel that you are participating in the process by giving, because we share with everybody without charge. So we would like you to trust us with your dinero, with your money, moolah, and we will certainly invest it wisely with programs of this sort. Let us close with prayer, and then those of you who'd like to say hi to your friends and so on can do so. Let us bow our heads for prayer. Dear God, we thank you for this lovely day. We thank you for this excellent program. We pray that you will continue to bless us in every way that you deem necessary. May our health be managed properly so that we can be mobile and agile and be able to disseminate very important information to those with whom we come in contact. We thank you for the fact that you created us, and now we look forward to the time when you will ultimately take us to a place where we'll never have to worry about cancer, sickness, or any ill disease. We pray that we will have that privilege real soon, because we want to bask in the sunshine of your presence and glory. Keep us faithful. Continue to bless this church, and may we make great strides in sharing with our community, sharing with various people and peoples the wonderful message that you have given to us. Thank you for hearing our prayer. This we pray in the name of the Father, in the name of the Son, and in the name of the Holy Spirit. Let the people say amen and amen. Good night, everyone. Good night. Have a wonderful rest of the evening going night. And you can, unmute and speak to each other as we leave this place, or leave the virtual platform. Thank you very much. Thank you, Doc.
Thank you.
Hi, Cheryl.
Hi, Robert. I heard you.
First
I
lady.
heard your baby question.
Yes, yes. I got to plug that one in, you know.
Listen to me, man. I almost died when I heard it.
Yes. Is Aldith there? There?
Who?
Aldith.
No, I invited her, but I was looking all day unless she's on a device that I don't know. But I
I'm not sure.
invited her.
Yeah, she sent the link to me as well.
Okay, good. Listen,
Yeah.
we have to talk off camera for Harborview. We're doing a reunion next year.
Okay.
Yeah. So I'll
Let-
call you. I'll call you. I need your WhatsApp and all of that. Okay.
Okay.
Inbox me
Okay.
your contact again because I think it
I
got messed
will.
up with my phone.